Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video I'm going to be discussing hypoproliferative anemias. Alright, let's get started. Before we start into talking about the details of hypoproliferative anemias, it's important to talk about a few key terms that are going to be used throughout this presentation. So the term hypoproliferative means a decreased production of any cell type. So this can be red blood cells, platelets, and all the different white blood cells, so lymphocytes, monocytes, neutrophils, eosinophils, or basophils. The term hypocellularity means that the area of the hematopoietic stem cells in the marrow is replaced by fat. So remember that the red marrow is the hematopoietically active marrow, so the marrow that is actively producing blood cells to be pushed out into the peripheral bloodstream. So the yellow marrow, the marrow that has those adipocytes or fat cells, is the marrow that is not active. Aplasia is a term that in general means the failure of a tissue or organ to develop normally. In terms of the bone marrow, this means that there is not a functioning marrow. There's an overall decrease in hematopoietic cellularity. Hypoplasia is a term that means that there is a lack of cells present in an organ or tissue. So in a hypoplastic marrow, there's a lack of cells. And this is caused by the proportion of hematopoietic cells to fat cells is decreased within the bone marrow. So hopefully these terms will help you better understand what I'll be talking about in this lecture, and it might be helpful to go back and review my hematopoiesis lecture early on in the hematology lecture series. So we know from the previous slide that the term hypoproliferative means a decreased production of any cell type. So hypoproliferative anemia is an anemia resulting from a decreased production of cells. So this is due to a bone marrow failure. So remember, the red cells, white cells, and platelets all come from the bone marrow. The failure of the bone marrow is going to result in either one cell lineage or multiple cell lineages, depending on what is going on, to be decreased. So this bone marrow failure is due to a hematopoietic defect, depletion or damage of the marrow, or inhibition of the stem cell. So inhibition of the stem cell, so what does that mean? So remember from my hematopoiesis lecture, remember it all starts from that hematopoietic stem cell, and that hematopoietic stem cell either becomes a myeloid or a lymphoid precursor. The lymphoid precursor becomes what? Lymphocytes, right? So the myeloid precursor can become what? So everything else. So this becomes either a red blood cell, a platelet, or any of the other white blood cells that are not lymphocytes. So if one or more of these stem cells is inhibited, that is going to not allow those cell types to be made, right? So this is hypoproliferative anemia. So what hypoproliferative anemias are we going to be discussing? So aplastic anemia is a little misleading in that it's called just an anemia. We know by definition that anemia is the decreased red blood cells or hemoglobin levels in a patient. And that is happening in aplastic anemia, but this is actually a reduction in all of the cell lines. So this is something that we call pancytopenia, which means red blood cells, white blood cells, and platelets are all decreased. So that's the first hypoproliferative anemia that we're going to be talking about. And then we have pure red cell aplasia, and this is where the erythroid progenitor cell is affected. So only the erythrocytes of the red blood cells are going to be decreased here. So white blood cells and platelets are not affected with pure red cell aplasia. Aplastic anemia is a rare disorder that causes a failure of the bone marrow. The yellow bone marrow, which is made up of adipocytes or fat cells, replaces the red hematopoietically active bone marrow. So if the amount of hematopoietically active bone marrow is decreasing, less and less cells are going to be made. So we're going to have a decrease in all cell types within the marrow and the peripheral blood. The cells that are made are functionally normal and they look normal. Because nothing is making them abnormal. They just are being made in lesser quantities. Patients with aplastic anemia are going to have pancytopenia, so a reduction in the number of red and white blood cells and platelets within their peripheral bloodstream. This is a normocytic normochromic anemia, so normal MCV and MCHC values. They are also going to have something called reticulopenia, which is a reduction in the number of reticulocytes. So do we remember what reticulocytes or retics are? They're the precursor to the red blood cell, just before the red blood cell in the maturation lineage. What would we call it when we see reticulocytes in the peripheral blood smear? Do you remember? It's called polychromasia, right? So we have a reduction in the number of all cells within the blood, and the marrow is going to be hypocellular. So how does a patient even get aplastic anemia in the first place? So it can be congenital, meaning it is present at birth. This accounts for about 30% of all childhood cases of aplastic anemia. There is something called Fanconi anemia. So this is an autosomal recessive genetic syndrome where aplastic anemia is actually the hallmark characteristic. A majority of the time, aplastic anemia cases happen in adults, and around 70 to 80%, which is really a large chunk of them, are idiopathic. The remainder is secondary to a biological or chemical cause, so certain drugs, viruses, if the patient is undergoing radiation, it can cause it. Pesticides can cause a person to develop aplastic anemia. It can also happen during pregnancy, although it's rare for that to happen. So we know what we as medical laboratory professionals will see in the blood smear of somebody who has aplastic anemia, but what kinds of clinical symptoms would a physician see in a patient with this anemia? So symptoms really vary. Weakness and fatigue and paleness, which are symptoms that we would expect with a patient that has anemia. Sometimes even cardiac failure and death can occur from this. These patients have a decreased level of platelets, so they're going to experience petechiae and bruising. And petechiae are small red spots on the skin caused by the hemorrhaging of capillaries. So we know platelets are a part of the coagulation process. So with a reduction in platelets, these patients are also going to have a tendency to bleed. So nosebleeds, bleeding gums, they can even have brain bleeds happening. Now, white blood cells are also going to be decreased. So aplastic anemia patients are going to have a tendency to develop infections. So fever and bacterial and fungal infections also occur. And this is because there is a reduction of those white blood cells, which help to fight off these infections. And of course, these patients have a decreased number of red blood cells. So their hemoglobin is going to be decreased, usually around less than 7 grams per deciliter. Ferritin, iron, and saturation are all going to be increased. And of course, the marrow is going to be hypocellular if the bone marrow biopsy is ordered on these patients. Now, official diagnosis of aplastic anemia requires the bone marrow biopsy to show hypocellular bone marrow, so a decrease in the number of cells in there. And then also the patient must have at least 2 of the following values. So white blood cell count of less than 0.5 times 10 to the 9th power per liter, a platelet count of less than 20 times 10 to the 6th power per liter, and or anemia with a retic count of less than 1%. If the aplastic anemia is caused by a secondary cause like a drug, obviously that drug needs to be discontinued immediately. Patients can be treated with immunosuppressive drugs, but usually the best case of action is to give the patient a bone marrow transplant. Outcomes are usually not very good for these patients, and the death rates are very high for aplastic anemia, unfortunately. Diamond-Blackfan syndrome is a disorder that causes pure red cell aplasia. All right, so now we've gone from these pancytopenia, aplastic anemias to this pure red cell aplasia, which is a Diamond-Blackfan syndrome. So only the erythroid lineage is going to be affected here. So this is just red blood cells being decreased. So this is a rare congenital and unfortunately progressive aplasia occurring in very young children. They can have general anemia symptoms, so paleness, weakness, and fatigue, but symptoms can vary. Patients can have growth abnormalities, so retardation of growth, smaller head size, webbed necks, malformed hands. Sexual development can also be affected, and patients can have issues in their cognitive functioning. There can be other pancytopenias that are different than aplastic anemia. So a decrease in red blood cells, white blood cells, and our platelets that isn't from the result of a defective stem cell proliferation in the bone marrow. So one of these is myelophthisic anemia, which is an anemia where the marrow is infiltrated by fibrotic or granulomatous cells or neoplastic cells, which are cancerous cells. So this can occur in certain cancers, so cancer of the breast, stomach, and prostate tissues. It can also occur with something called myelofibrosis, which is a cancer of the bone marrow itself. Patients with tuberculosis or those with certain types of viral or fungal infections can also develop this. So in this type of anemia, this infiltration of the bone marrow just pushes out the normal cells from the marrow. Normal hematopoiesis is reduced just because there's just not enough room in there, and the inner architecture of that bone marrow is just completely changed, which is going to, result in problems. All right, and then myelodysplastic syndromes are a group of disorders that result in issues within the bone marrow. These usually end up becoming acute leukemias, unfortunately. Some have pancytopenia, so a reduction in all 3 cell types, bicytopenia, so a reduction in 2 different cell types, or just a reduction in 1 cell lineage. Macrocytes are common in these disorders as well, so larger than normal red blood cells. And the marrow can either be normocellular or hypercellular. So I'll talk more about myelodysplastic syndromes in my lectures on blood cancer, so go ahead and check those out. Alrighty, so that ends this lecture here. If this video helped you out, go ahead and give it a like and make sure to subscribe to my channel for more educational laboratory content. If you have any questions specifically about this lecture, go ahead and leave them in the comments below. I'll be happy to answer any questions for you. Alrighty, until next time.